Now, back in July, a statistical anomaly was spotted, which changed the way that deaths from COVID-19 are counted. Previously, Public Health England included any death of a person who had once had COVID-19 as a coronavirus fatality, even if they'd recovered from the virus and died of another cause. Now, the man who spotted that was Professor Carl Heneghan from the University of Oxford, someone who has been quite critical of the UK's decision to lock down. He joins us now. I'm not sure if you managed to catch any of my interview with Matt Hancock, but he was effectively saying that he can't rule out further national restrictions if people don't do things like obey the rule of six. If cases continue to rise, do you think the government would be right to tighten the rules further?
Well, look, this is a time to now just be calm and cool and particularly analytical at what's happening. What we're seeing is that the virus is operating in a seasonal way. As we've gone back to schools, actually, what's happened now is we've seen about a 60% increase in consultations for all acute respiratory infections. And that's what's driving the problems in the test and trace program. All the young children who have coughs and colds and these infections, one of them is an infection called rhinovirus. In fact, as we look at the data, COVID is operating in a similar seasonal way and mirroring that respiratory infection. So what we have to do now is slow down. This is a long winter. We cannot afford to go now with harsh measures because, as Len just said, the impact on the economy here is going to be significant, because what happens is, soon as you pause, then you open up again, it tends to come back. The problem for the government is what we can't afford to do is people to become complacent. So we still have to be vigilant about ensuring the infections stay manageable across the board.
Some would say, though, that it's better to act early so we don't have to lock down too stringently in the future. So, if you like, the idea is that as the cases start to tick up, there's concerns that it could lead to exponential growth. The R rate is increasing. And so actually acting early would mean that we wouldn't have to have the heavy fist of another national lockdown in the future.
Look, I think that underpins a fundamental misunderstanding of what happens with community pathogens. Whatever you do, if you lock down now, you slow down the progression slightly, but then you'll get a resurgence. Because what happens is in the population is there has to be a level of immunity for this to become manageable. So a very good example of this will be Oldham. If you go and look at Oldham data today, on August the 2nd, they had a resurgence of cases, came in hard, restrictive measures, more test and tracing. But actually in the last week, they now have the highest case numbers they've had in the last 8 weeks. So this is the problem. What we do need to do is create a test and trace system that's highly effective, let that work. And what you're seeing amongst the population is a single message that is now missing, is if you have symptoms, you have to isolate. And I'm picking up a lot of people who just do not understand that because we haven't been clear about that messaging. And this is incredibly important. It's become so confusing. People think if you've got the rule of six, they can go about even if they've got symptoms. So we need to clarify and make the messaging very simple for the population. And if we do that, we can go through the winter highly vigilant and not need lockdowns.
It's interesting that you talk about the messaging and some of the confusion around it. In the Mail on Sunday today, you've said that the Prime Minister is surrounded by mediocre scientific advisors. What do you mean by that? What mistakes are they making?
Well, look, one of the problems here is this is a pathogen that affects healthcare. It is directly impacting on public health doctors who are at the front line trying to manage this. I speak to them on a daily basis, get emails. Clinicians like primary care doctors who manage respiratory infections all the time. One of the bits that's missing in the architecture is all of them people input into the advice system. There are too many non-clinical people focusing on a single disease, COVID. The second issue, every time you decide to lock down, you should have competing models that say, what's the impact now going to be on other diseases? Because it is huge every time you do that. So this has to go in the mix now when you make decisions. That's why we're saying slow down, get a wider range of expertise in the room so you can make a much more balanced decision about what you're going to actually do and its impact, not just on COVID. What about all the other infections? What about all the cancers, the heart disease, all of these other issues, and then your educational, and then your social situation, and the economy? They all have to go now into the mix of the decision.
Are you worried that the negative impact of lockdown and also further restrictions, as you just outlined, could actually outweigh the negative impact of the virus itself?
I'm going to tell you what I think right now. If we go now, it's too early. We have to understand the context of respiratory infections. Between now and Christmas and about January, consultations will go up fourfold for respiratory infections in primary care. That's in a good year. In a bad year, they'll go up eightfold. Everybody in the background with children will recognise this. As it gets colder, as we're inside more, there'll be more coughs and colds. Therefore, there may come a point in the winter when actually there's a need for restrictive measures. If I was talking about what the Prime Minister's talking about, a cycle break, I'd be looking at the Christmas break right now to extend it. And I can tell you why that's the case, because often when we come back in January, there's a significant rise in deaths in the month of January, about 5,000 per week more than what we see right now. And that's due to the seasonal effects. Therefore, if you're looking at a break and when we need it in the midwinter when we might run into problems. But actually, it would be more explainable to people why we're doing it then than now. There's no evidence right now of what's called a second wave, because that's about the
So the
impact.
Prime Minister's wrong then?
Well, look, what we've got to do is, what's difficult here is I get for our ministers, this is an incredibly complicated area. Some of the issues we're talking about require 5-6 years of healthcare experience to really get your head round. So this is about good advice to the Prime Minister, to the Health Secretary, that allows a wider range of expertise to come on board. And if they did that, they might look at the problem slightly different. What they do have a problem, though, as I've said, is can't afford the population to become complacent. So I think over the next few weeks, if we can see a more slower analytical approach to the data and a different approach to the advice, the Prime Minister might see a subtle change in his language that reflects a need to normalise what's going on. This is a seasonal effect now. And if it becomes worse and it becomes impacting on disease, then yes, that's the point when we ask for restrictive measures. But that is not, time is not now.
Now, you've said previously that we need to have a rational debate about when it is better to get this infection. Do you think there's an argument then that we should be relaxed about or even encourage people under the age of 45 getting coronavirus?
Well, what there's been a tendency under the government is to focus on the worst case scenario countries. So they looked to Spain and said, look, here's where we're heading. But you could look to other countries. You could look to Sweden, who've had this rational debate. Now, remember, Sweden didn't do nothing. They managed, they controlled the disease so that in the population, it was at manageable levels. So through the summer, they had much higher cases than we had, when the impact of the disease is low, and actually its impact on healthcare services is much lower. That's creating population immunity. The only other way to do that is through vaccination. And it's looking like the vaccination is not going to be available until the end of the winter. And even if we do have a vaccination, there'll be need to get some level of population immunity, which is what we do for all other infections in the community. That's
At the
what
same
children...
time, though, the recent studies seem to suggest that our immunity levels are pretty low, perhaps, as you say, because we haven't followed the model like Sweden. And obviously, this is a very deadly disease for older people, vulnerable people. Are we really saying that you're asking people to shield indefinitely? What, do they have to go to work? Are you saying that they're not allowed to see their grandchildren? I mean, what kind of life is that?
No, look, for instance, if you look at Germany, Germany is a very good example. One of the issues in Germany is the over 75 case fatality rate is the same across Europe. Completely the same. It's not like their healthcare improves their outcomes. But what they did is have a strategy to reduce the number of infections in over 75-year-olds, where over 75% of the deaths occur. So if you understand that basic principle, yes, right now, there is a signal in care homes that we need a care home control plan as a matter of urgency to shield that population. If you do that well, you'll get rid of 40% of the mortality. If you improve nosocomial infections, hospital-acquired infections, you may get rid of another 10 or 20%. Well, there you've got 60% of the problem, because this affects the most vulnerable, the most frail, which most respiratory pathogens do. Now, if we don't accept that the disease is endemic and out there and have control plans, what we're doing is misguided and not putting our attention where it's required. It's required in reducing the infection in the most vulnerable, in the most frail.
Very interesting perspective indeed. Carl Heneghan, thank you so much for being on the show today. Thank you.